Yes.
Okay. So the first thing we're going to do to administer surfactant is you always have to have the infant intubated in order to do so. So we'll go ahead and intubate this infant. Okay. So this infant is currently intubated at 10 at the lip. And this is important to note just because you want to ensure that the NG tube you're going to insert after you intubate is 1 centimeter shy of the measurement at the lip. So if we're inserted to 10 centimeters, the NG tube needs to be inserted to only 9. So the ET tube does need to remain in a fixed position. So at this point, we will just go ahead and tape ET tube in place. So ET tube is fixed at 10 at the lip. Next thing we're going to do is you want to use either 5 cc or 10 cc syringe and withdraw surfactant from the vial. Any infant that is transferred out of our hospital to a different hospital who we administer surfactant to, that vial should be sent with the infant. So if we end up not using all the surfactant in the vial, you want to withdraw however much you need for this infant. Surfactant is 4 mLs per kilo, and Infrasurf is 3 mLs per kilo. So and you round that to the nearest half ml. You withdraw that into a 5 or 10 cc syringe with a needle, and then using a second sterile needle, you will withdraw the rest of the amount in the vial, cap that second needle with the extra surfactant, label it, and store it in the pharmacy so that you can use on another infant down the road. And then that now empty vial can be sent with the infant. So withdraw the surfactant in the amount that you need. For this infant, let's say this infant is 2 kilos, and this is Infrasurf. So 2 kilos, 3 mLs per kilo. I'm withdrawing 6 mLs. Next thing we're going to do is you take the syringe or the needle off the syringe, and you're going to insert your NG. So like I said, this infant was taped at 10 centimeters at the lip, so you're going to insert the NG to a depth of 9. We're using a 5 French NG tube. So you can see the numbers of the NG tube through the ET tube. So 9 is currently right here. So I'm going to advance the 9 to the lip. Then we're going to hold the NG tube in place right here. And then I need a second person to take this syringe, and we're going to pop it onto this NG tube. I'll just do it myself here. So this person's still holding this. Second person does this. And then what we will do is half of this dose, so of the 6 mLs, 3 mLs will be inserted the first time, and then we'll reposition the infant, and then the second half of the dose, the other 3 mLs, will be inserted during the second half of this. So what we're going to do for the first half is the infant will be turned either right side or left side up, it doesn't matter. But for this instance, let's turn the infant right side up. We're going to push very quickly from 6 mLs down to 3 mLs, insert half the dose, remove the NG tube, and then end up bagging that surfactant into the infant's lungs. And during this whole process, the infant needs to remain right side up. So you're going to bag the surfactant into the infant, and you want to bag for at least 15 seconds to ensure that all the surfactant has cleared the ET tube and is into the infant's lungs. Once that's done, and you may see that whitish surfactant fluid in the ET tube as you're bagging it through. Once that's done, you're going to reinsert the NG tube. You can lay the infant flat for that again. Reinsert the NG tube to the same marking. So again, 9 centimeters at the lip. Hold it in place. Again, that second person will push the rest of the surfactant, but now the infant's going to be in the opposite direction. You're going to be left side up so that the surfactant can naturally flow to the opposite lung. And then again, push the rest of the surfactant in that position, and then again pull out the NG tube and bag that infant with that so that surfactant can get pushed into the lung. Okay? And again, we bag for at least 15 seconds. Most institutions do it between 15 and 30 seconds to make sure that the surfactant is cleared. Once that is done, you can place the infant supine again, and that's it. You have to mark the date and time that the surfactant was administered. And the key is, if we're going to administer surfactant, you have to make sure that we do a good job of administering it no matter which hospital or care center this infant goes to, the next care team cannot administer any surfactant to this infant for the next 12 hours. So if we're going to do it, we have to make it worthwhile, or else the next care team responsible for this infant can be in trouble if ours was ineffective and yet the infant still needs surfactant. So this administration does require 2 people. There will always be a physician present who can help administer the surfactant, and we'll make that part of our policy. If the infant is ill enough to need surfactant, there should always be a physician present. And between the physician and the respiratory therapist, there should be enough hands to be able to do this, leaving the nursing staff to be able to care for the rest of the infant, checking labs, placing IVs, things like that. So if there's any questions, you can always contact me anytime. Thanks.
Thank you.
Mm-hmm.